Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nick Nickham, a cardiologist from Houston, Texas. The feature presentation is statins versus supplements, which are better for lowering your cholesterol level, especially the LDL, which is the bad cholesterol level. So let us begin with the feature presentation. Before we go into the studies that I'm going to talk about, first let us understand what is the subject we are talking about. We are talking about cholesterol level and the risk of heart disease. Anytime the total cholesterol level is greater than 200 milligram or triglycerides greater than 150 milligram per deciliter, or LDL, the bad cholesterol, greater than 130, and the HDL, the good cholesterol, less than 35, it increases the risk of heart disease. When you see a primary doctor or a cardiologist and they say you have an increased risk of heart disease, the first reaction is going to be natural, of course. I say, I'll try diet first. Let's check the blood test again in 2-3 months. Then we can see if we need the medications. Or you can say, oh, doctor, I'm going to try diet and I'm also going to try some supplements. I heard a lot about supplements that can reduce the total cholesterol level. We're going to look into this topic of supplements versus medications when they are indicated. Medications may not be indicated for every patient with mild elevation of cholesterol levels. Diet. I think everyone should try diet, but with the best diet restrictions, you can reduce your total cholesterol level by maybe 25 milligram percent. However, if your total cholesterol is like 280 milligrams percent, then remember, you cannot reduce your cholesterol to below 200 with diet restriction alone. Then the next step is the natural response is, oh, I want to try some supplements. I think I heard a great deal about all these supplements. Okay, let's look at what are the supplements that we are talking about. We heard about red yeast rice, which is supposed to contain a substance similar to the statins, which we are going to be comparing it to. Then people talk about, I can try garlic. I love garlic. I like garlic bread. I like garlic food. And yes, it can, but it's not significant to account for any substantial decrease. Fish oil. Every supermarket you go, you see fish oil as a supplement that can reduce total cholesterol level, triglycerides. They all have omega-3 fatty acids. Yes, indeed. Turmeric, cinnamon, plant sterols. All these account for millions of dollars worth of business, but do they really help you? That is the main question we're going to look into. So if you're thinking about, okay, I'm going to try some supplements and see if I can reduce my cholesterol from 250 to 150, it ain't going to happen. I already told you how much a diet can do. Now let's look at how supplements can do, because what you're trying to do has already been done by Cleveland Clinic. The Cleveland Clinic, Dr. Stephen Nason, the director of the Cleveland Clinic, along with his team, looked at exactly what you're trying to do, that is using supplements to reduce your cholesterol level. They took a population of healthy people between the ages of 45 to 70, 190 people, half of which were treated with a medication called rosuvastatin, which is a statin, 5 milligrams. There's a very small dose of cholesterol lowering medication. Anyway, and compared that to half of the group which received all the supplements which I talked about in the previous slide. And these people had no history of heart disease. They had LDL cholesterol levels ranging from 70 to 189, and they had increased 10-year risk of heart disease. What do I mean by increased 10-year risk of heart disease? You can just Google calculate my heart disease risk, and it will take you to a website set up by the American College of Cardiology and American Heart Association, where you can plug in your age, your total cholesterol level, your triglyceride levels, and your associated medical conditions like hypertension, diabetes, or vascular disease, and it will spit out your 10-year risk of heart disease. If you have an increased 10-year risk of heart disease, then you need to be seriously talking to a specialist, a cardiologist, or someone who deals with lipid management. We're getting back to the study. They looked at the level of LDL, the bad cholesterol level, at the end of 28 days. In the two groups, those who were treated with statins, rosuvastatin 5 milligrams daily, that's a very small dose, with the supplements, all the ones which I listed above. The conclusion from this study was the difference in the LDL reduction in the statin group was substantially better. That is, the statin group had a 35.2% more reduction in the LDL compared to the supplemental group. This is a clear point that we need to understand, that if your cholesterol level is high, especially if you have bad cholesterol, the LDL level is high, then these supplements do not really do a justice in trying to accomplish what your goals are. In fact, Steve Nason of Cleveland Clinic, the main author of this study, said the supplements, they do not promote health. They do not significantly improve the level of bad cholesterol, namely the LDL cholesterol. In conclusion, I also want to add a point that the American College of Cardiology and the American Heart Association have come up with guidelines for managing cardiovascular patients across the spectrum of cardiology diseases. With reference to the LDL cholesterol, the ACC-AHA guidelines says that if the LDL cholesterol, the bad cholesterol, is greater than 190 milligram per deciliter, we are advised to start a patient on statin. I would strongly advise reduction in dietary intake of carbohydrates, fat, and cholesterol. That will help to reduce your total cholesterol by at least 25 milligram percent. By reducing your weight, by reducing your blood sugar to a normal level, helps to bring down your triglyceride levels significantly. Finally, exercise. Exercise is one of the few things besides statins that can increase your HDL level or the good cholesterol level. I hope this has been educational to you. I am Dr. Nick Nickham, a cardiologist from Houston, Texas. We have a number of presentations on heart healthy lifestyle. Please do watch them. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel, and I will see you in the next presentation.